I have not been on Jon Stewart or Colbert, but we will go if invited. We've been on Glenn Beck Radio, Neil Cavuto, Joe Scarborough. We've gotten a lot of CNN. We've gotten a lot of national interviews, and that's people say, is your dad helping you? Yeah, the door has been opened much wider than for many people, but I don't run away from that. We've had a lot of bad family dynasties like the Kennedys. Maybe we could have a good family dynasty.
Two things. One is you could tell from the response that everyone was happy to hear about the term limits. I think nationally that would be a winning issue for any candidate with the congressional approval ratings being so low and the shenanigans we've all seen. And I would urge you to continually stress that message. I think it's almost a single issue thing that will help push people over the top. The other is, how do you differentiate yourself from Mr. McConnell's candidate?
The main thing is I go around saying I'm a physician, I'm a small businessman, and have been for all of my adult life. My opponent, who's being supported by the National Senate Republican Committee, 23 senators, most of which voted for the bank bailout, is a career politician. He's a young man, he's 37, but he's been in office 10 years. He's never had a job outside of government, so I think that's one big distinction. He's also opposed to term limits, which is another distinction. I talk constantly about the bank bailout. He never brings it up. One political pundit in Kentucky said it could be an interesting race because my opponent has studiously avoided taking any positions for 8 years because he wants to please everyone, but maybe I've taken 1,000 too many positions. Yes, and he's an attorney. Yeah, there aren't many physicians. We've got a great physician here, and there's about 3 or 4 others, and I think we're about 75% good on the physicians, maybe in Washington. So,
Hi. Yeah. You mentioned the concept of term health insurance. Well, perhaps you should let the insurance industry experiment. Something like whole life health insurance might be something that might want to innovate, where you paid for 30 years from age 25 to 55 or whatever, and then it's paid off. And perhaps you could invest into it, and it would be something that you own permanently and could hand off to your heirs. And your health insurance is paid off for good.
Absolutely. Great idea, and I'll start using that. But the thing is ultimately, even when I say term life, we need to make it like term life insurance, I'm not going to write a bill saying you have to have it. It's somehow figuring out how to get the government out of the way so these products will develop. I mean, most of the time, like to get your tax deduction, you can't buy a $20,000 catastrophic policy because you will not get a deduction for it. It's not under the official plan. And we did that in Kentucky. You narrow what can be sold, and mark my words, if we get the mandates passed, the real danger is that committee that determines what insurance you can buy may not have health savings accounts on it at all.
And we're hearing from another physician legislator right here.
Thank you. As a representative from the state of Oklahoma, I have authored or in the process of authoring legislation to opt out of Obamacare or any health care federal mandates that are coming to our state, similar to other states that are like Arizona, Florida, Utah, that are doing this as we speak. I want you to comment what you feel about that according to the 10th Amendment.
Wonderful idea. And anytime we can make our ideas part of the states' rights and the sovereignty movement is good. I was talking to Dr. Orion about that. They've got a referendum in Arizona as well. All great ideas and things we need to do to try to push the debate forward.
Could you talk a little bit about, is the federal government right now monetizing the debt, and talk a little bit about that?
Yeah, they are, and I don't know if I can go through all the statistics of how much is being monetized, but yes, and I think we're going to lean more heavily in that direction as we're able to borrow less, and I think that's coming, and there have been lots of stories about that recently, and I think that's in our future, and when you directly monetize it is when there's greater danger of creating price inflation. So.
And I'm going to take the prerogative of the last question, but it's not a softball, and that is the question of dealing with with liability reform and lawsuit abuse, because we've got a sticky situation where we're concerned about doing that at the federal level. Right. Prohibition from the federal legislation messing with the state court system. Right. So how can we put pressure on the states, and how could you put pressure on the states to move that direction?
Right. I'm one of those who does think that probably the Constitution prohibits the U.S. Congress from doing tort reform in the state courts. as much as I want tort reform, as much as I'll vote for any tort reform that we can get forward, I don't think that'll be upheld because of scrutiny. Now, we could have tort reform for federal courts, but nobody really gets sued for medicine in federal courts. You can do that. I'm not sure other ways we can pressure it from the federal government. Ultimately, you have to win battles at your state legislature for tort reform, and really the trial attorneys are so powerful within the Democrat Party and all these legislators, it's very hard to get it. One more?
One more question.
All right. Do you want to?
Possibilities would be to bring lawsuits against the government on a constitutional basis if they push this through on us.
Yeah, that's a good point. I wanted to respond to that because I forgot about it, is that I think it would be good, particularly if AAPS wants to choose a lawsuit. I think a great lawsuit, we have Mennonites in my community for religious reasons do not want to have health care. They always pay, they come up, they negotiate a rate with you beforehand. They're hardworking people, they're great people, but they don't have health insurance. That'd be a wonderful lawsuit to get one of them to sue over it, or any other religion. So then you combine sort of the religion as well as the freedom aspect or states' rights aspect with it.
I guess, and we will, I misspoke. We will give our president the prerogative of the last question.
There is a way to do it constitutionally. The Constitution requires that contracts be enforced. At the state levels, they will not allow a physician to sign a contract with a patient to say, if you sue, it's only going to be for economic damages, it won't be for pain and suffering. So at the federal level, you could constitutionally require the states to adhere to contracts between physicians and patients.
And I think that sounds like a good idea, and I'd support that. Thank you very much.
One last question. I'm going to let you go. I will finish with a softball. What was that website again?
The website's randpaul2010.com. Thank you very much.
Thank you.